American Association of Orofacial Pain defined TMD as a group of disorders involving TMJ, muscular muscles, and associated structures. Temporomandibular joint disorders are second most common musculoskeletal disabilities after chronic low back pain, and most common symptoms and signs include pain in the TMJ area, restricted mouth opening, and clicking jaw joint. The etiology of TMDs is considered to be unknowable and not verified. However, combination of multiple factors are responsible for TMD development, and treatment aims TMD treatment aim is symptom relief and not cure. There are several problems regarding the clinical management of TMDs. There is a lack of clinical guidelines and well-established and evidence-based clinical guidance for managing TMDs, and therefore use of invasive treatment methods needs to be justified. According to US data, 75% of Americans experience symptoms of TMD at some point during their lifetime, and 5 to 10% of them develop severe enough symptoms to require treatment. About 15% of them go on to develop chronic TMD symptoms with persistent pain and psychological symptoms. So there is a lack of studies. Most of the studies conducted in this field are quantitative, describing the TMD symptoms, and are conducted in high-income countries. And there are only very few studies, qualitative studies, which try to explore the TMD symptom experiences in low and middle-income countries. And there is a lack of any data about TMD symptom prevalence in Armenia. Therefore, we found that there is a need for qualitatively describing the experiences of TMD symptoms among residents of Yerevan, Armenia, from the perspectives of individuals with symptoms and dentists. The method that we used for the proposed project was the study design was qualitative cross-sectional design and with conventional content analysis. Participants involved in the study were individuals with TMD symptoms 18 years and above, and dental providers of different backgrounds. The individuals with symptoms were identified through using Fonseca's screening tool, which is an easily applied low-cost screening tool and allows to identify most common TMD symptoms in the general public. And the study protocol was reviewed and approved by AUA IRB. So we conducted 2 focus group discussions with 9 women with TMD symptoms. We recruited them by using convenience strategy. Their age range was between 23 to 40 years, and mean duration of the interviews was 23.5 minutes. We also had 8 in-depth interviews with dental providers of different backgrounds. Those were general dental practitioners, maxillofacial surgeons, orthodontists, and prosthodontists. Mean duration of the interviews was almost 20 minutes, and total number of our participants was 17. The study team members developed 2 brief semi-structured interview guides with open-ended questions for different types of data collection methods. And we collected data was transcribed and translated right after the interviews, and inductive approach to data analysis was applied. The triangulation of experiences and perspectives was done. So the main results were summarized in 3 descriptive categories. Those were about complaints that participants with TMD symptoms experienced, TMD symptom management practices, and problems faced while seeking care for TMD symptoms. The first major category, not unbearable but unpleasant, represents the life of living with TMD symptoms. It comprises of 3 subcategories, and the first one is trying to open my mouth a little bit. It describes the problems that TMD patients have due to their symptoms. Those were the most often repeated symptoms were pain in the jaw area, clicking jaw sound, being unable to open their mouth fully or at all, frequent headaches, grinding the teeth, and a sense of tension because of pretenditis. One of our participants described her symptoms this way: I was not able to open my mouth even a bit to eat something. It happened with me that I was waking up in the morning and wasn't able to open my mouth. I was even trying to open it a little bit with the help of my hands just to be able to brush the teeth and get ready for the work. Our next subcategory, everyone's attention is on me, demonstrates the anxiety and distress associated with the presence of disturbing complaints. And our participants describe their complaints in the following way. Let's imagine that for 5 years you wanted and weren't able to chew something. It causes both gastrointestinal problems and nervous disorders. In one word, definitely these two factors play an important role for the quality of life. Another participant who had symptoms said that my main complaints are clicking. While chewing food, it's always heard. One always can hear that sound. So when I'm eating in a new environment, I try to eat more carefully. Our last subcategory, a perpetual load on my shoulders, demonstrates that our participants with symptoms perceive their symptoms as very unpleasant and a burden that they had to carry on and live throughout their life with those symptoms. An orthodontist said that it is very rare for patients to have unbearable complaints, but it's like a load on one's shoulders that a person always carries. Another participant with the symptoms said that showing the TMJ area said that it kind of gets locked, and when the pain goes down, showing the neck, it's kind of very unpleasant. I cannot say that it's very unbearable, but anyway, I keep feeling it. Our second main category is named Cope Until Pain Gets Worse, and it demonstrates the practices that our participants mentioned about their symptom management. The first one, try to not pay much attention, is about our participants trying to adapt to their symptoms and reconciling with them. A woman with symptoms said, I cannot describe it, it has some influence. All this is not limited to that TMJ area. Sometimes you think the complaints are not very serious, that's why you try not to pay much attention to it. But from the other side, it causes some annoyance and anxiety. Besides adapting to their symptoms, participants talked about strategies that they came up to avoid experiencing these symptoms. And a woman said, during the day, I try to relax the muscles, like when doing meditation, to avoid the habit of pressing the teeth and therefore having pain. Our second subcategory, see a dentist when pain medicine doesn't work, showed that participants sought professional care only when their symptoms became bothersome, and pain was the most repeated symptom that prompted them to seek care. The most disturbing factor for all patients is the pain, and because they always think that it will disappear, they use medication at the initial stages. It helps them to relieve the pain, and they don't refer to a specialist. They refer when they use medication and it doesn't help. However, besides pain, limited mouth opening was another reason mentioned by our participants as prompting to seek professional care. Our last category, ineffective procedures and persistence of symptoms, demonstrates the problems that our participants with symptoms experienced while seeking professional care. One of the problems was persistence of symptoms despite following the recommendations of their treating dentist, and meeting indifference among dental providers after explaining their complaints. Participant of 24 years age said, also in my case, they've connected it with wisdom teeth and have extracted my wisdom teeth. The symptoms didn't disappear. I'm still having headaches, clicking sound, and sometimes I cannot open my mouth. So the treatment recommended by the provider was not effective. The other negligence that we observed by analyzing the narratives we can demonstrate through this quote. It states, I approached a maxillofacial surgeon for tension and clenching, which were always present and were disturbing me. He said, yes, this problem is present and you have to live with it. Well, if the problem gets worse, in that case you might need some surgery. But I didn't get any recommendation about what could relieve this condition. So these were the main findings of our study, and when comparing our findings with existing international literature, we saw that the majority of those were in agreement with them, particularly that participants were trying to cope with their symptoms on their own without any guidance of a dental provider, and only part of them referred to a specialist. And international literature states that only about half to two-thirds of those who are affected with TMD symptoms seek professional treatment. The other finding, which was in agreement again, was about pain as a major motivational factor for seeking professional care. However, there was an interesting finding about doing unnecessary recommendations, such as dental providers suggesting to extract wisdom teeth as for relieving the TMD symptoms. we were not able to find any such information in the literature, and on the contrary, there was an information about extraction of wisdom teeth and their association. There was a high risk for developing TMD symptoms. Based on our findings, okay, let me tell what were the limitations and strengths of the study. We were able to involve only women participants with TMD symptoms in the study. However, it was not intentional, this limitation was partially addressed by involving dental providers in the study, and triangulation of findings allowed to represent also opinions of men who have TMD symptoms, as dental providers were speaking about their women and men patients. And the strength of the study is that this is the first study that aimed to explore the experiences of TMD symptoms among individuals with symptoms and dental providers in Armenia, and the use of qualitative study design and inductive data analysis method allowed to describe yet unexplored experiences and perspectives in regards to TMD symptoms. Based on our findings, we find that this recommendation is in need. There is a need for directing greater attention to the experiences of patients with TMD symptoms. A better understanding of experiences of living with TMD symptoms may allow dental providers to be more attentive to possible TMD complaints. Thank you. Questions?
Thank you very much, Omer, for your presentation. I have a very small question. As you recruited mostly women,
yes.
Did you see such a difference between genders from the literature, just in the prevalence of the TMD?
Yes, I didn't mention this information in the slides, but the international literature states that women are twice more likely to have TMDs than men, and there are different, however not yet explored, but factors that they assume that are the reason for this phenomenon. Women experiencing more than men.
Thanks a lot.